During the first visit, the patient is oriented to the unit and introduced to the equipment and to the cardiac monitor hookup routine.
Also, you'll need one of these, and 3 of these. Okay? And they'll always be in the same place. And every time you come in, you'll want to get hooked up just like this.
At each visit, the patient's weight, resting heart rate, and blood pressure are recorded. A resting telemetry strip is examined before exercise begins. Stretching and flexibility exercises are normally performed as a beginning warm-up. Post-surgical patients should be especially cautioned not to attempt stretches that are uncomfortable. A 3 to 5 minute cardiovascular warm-up follows on treadmills or bicycles. The workload of the heart is then increased per each patient's care plan and is maintained for 3 minutes or as tolerated. After the first set of exercises and after each subsequent set, the patient should walk around the room slowly for 1 to 2 minutes to allow for heart rate recovery. The second conditioning exercise generally utilizes an arm exercise machine, with the workload set as prescribed by the exercise therapist. Typically, the patient alternates between arm and leg machines for up to 6 sets, followed by a 5-minute cooling down session. Patient response should be continually monitored by the nurse or therapist. The patient's heart rate, peak blood pressure, and telemetry strip should then be recorded. Patient education also continues, and the patient should be fluent in verbalizing his or her exercising target heart rate. Phase 3 is similar to Phase 2 but takes place in a group setting. This is the cardiac conditioning phase of cardiac rehabilitation and is designed to help patients attain an optimal state of health. This phase should enable patients to participate in non-monitored exercise programs in the future. Patients typically attend Phase 3 sessions 3 times a week. The objectives of Phase 3 are to assist the patient to attain an optimal physical state through exercise conditioning, provide an environment that facilitates the behavioral change which is needed for risk factor reduction, reinforce attempts at risk factor reduction, reinforce the patient's knowledge about coronary artery disease and treatment, and assist the patient to meet his or her goals. Patients meet these goals as they develop and continue a home exercise program, progress in risk factor reduction, understand safe exercise principles and follow exercise guidelines, and are able to verbalize their understanding of most aspects of coronary artery disease and its treatment.